I don't believe because we have limited resources, we should compromise in our impact or standards. As a lawyer, I was helping other people make money, get out of trouble. After a while, you find what's the meaning of doing that? What keeps you going? If I can give you life, but you have no hope, you're just living and surviving. This is your illness. You have to own it. We should be advocating for change.
What would be the biggest misconception that people have about your industry?
We live on love and fresh air. Many times people think we have no standards, but the nurses never stopped. They never had an opportunity to work from home. No one asked me for OT. No one asked me for day off. They just rose to the occasion and they stepped up. Not all managers are good leaders, but all good leaders have to be good managers.
Singapore leads the world in diabetes-induced kidney failure, with about 6 new patients diagnosed with the condition daily. Being the forerunner in the renal care community, the National Kidney Foundation aims to advance renal care and kidney failure prevention. Today, we have with us the CEO of the National Kidney Foundation Singapore, Tim Oei, who is a lawyer by training and has more than 15 years of experience in the social service, community, and healthcare sectors. Tim took the helm of the NKF in August 2017, and he advocates for a holistic care approach with the objectives of rehabilitating and reintegrating kidney patients back into the society to lead fulfilling and purposeful lives. He also believes that education is key to raising awareness on kidney disease prevention as a way forward for a better future. In this episode, we talk about Tim's leadership journey in the social service sector, how his work at NKF is deeply connected with his personal mission, and lastly, his advice for young leaders to thrive in the social service sector. Hi Tim, thanks so much for coming to our podcast today. Very happy to have you, very honored as well. And I have a question for you. You wear multiple hats as a CEO, board director of several national organizations. And how do you keep all of these plates spinning at the same time?
First and foremost, thank you, Eric, for having me. I don't see it as multiple roles. I see it as a single role, trying to make a difference in society in my own little way. Every organization I'm involved in has some similar trait, which is we're all trying to do good. The question is, how can we do good better? And resourcing is always limited. And I don't believe that because we have limited resources, we should compromise in our impact or standards. In fact, I think we should strive harder because the reason why we have limited resources is people are unaware or the needs are greater than what we can supply. And this is where I think the challenge is doing more with less becomes more real. And in our own little way, we can make a difference in the broader society.
Right. And you mentioned earlier just now that doing more with less. How is that a motivation for you from your transition from a lawyer to being in social service sector now? Is that the motto that you always have?
Well, being a lawyer was my past. Honestly, I never really wanted to be a lawyer. All right. I fell into an opportunity and I think it was a good life. It was tough, but on reflection, I think the training as a lawyer and practicing being a lawyer has actually helped me be a better manager and a leader and a greater understanding of governance, transparency, and a lot of the intricacies of the daily work. There's some element there. So I don't see as lawyer, social service. I see as an evolution for me. So I see as an opportunity to make use of what I had learned to give back to society.
Right.
But there's one element which I always believe, even as a lawyer, legal services is a professional service. How do you manage a professional service? I see social services as a professional service. How can we better provide a service that has a professional standard? I think when I came in 2007 into the sector, the social service sector didn't recognize itself as a professional service. They were just people doing good.
Yeah.
But standards were there, but people didn't understand what were the standards and why you needed to have standards. So my own view is there's similarity between managing a professional service in the legal environment and social services in the giving sector.
It's almost like transferring your skills as a lawyer in terms of managing people, having ethical standards, and creating systems to help uplift the ecosystem of the social service sector that what you have done over the last 15 years.
I will put it the other way.
Okay.
It's not law giving to social service. And I think what I've learned in social services, put a human touch to professional services. It's not just delivering a service and not understanding the humans.
Why is having a human touch important?
Okay, as a lawyer, I was helping other people make money or get out of trouble. Right?
Yeah.
After a while, you find what's the meaning of doing that?
Yeah.
And even when I was in practice, I tried to help people who go through difficulties understand their journey, be it matrimonial, be it a contractual dispute. Why is this happening? And don't just look at I win, you lose. How can we come together to mediate a good win-win solution? So I think social services also helps me understand how can you use hard skills and take the human element and deliver good outcomes.
They're putting the heart to the hard skill.
Yes.
Okay.
And that's, I think, the corporate world can learn. And I think a lot of corporate leaders are learning how to lead from the social service perspective.
Yes, we are seeing a lot of efforts in the corporate sector to do good as well, especially now with a lot of emphasis on CSR, corporate social responsibility. There are also companies who would like to step up to see how they can balance both profits as well as purpose. What are some of the pressing issues that your patients are facing that NKF and the corporate partners and the various stakeholders can help to assist your beneficiaries in?
It may be cliche, but I think it's a whole village approach. One thing we have to realize is that when our patients are diagnosed with end-stage renal disease, the world comes crumbling down. And it can happen overnight. Anyone who has been diagnosed with a chronic kidney disease or any other major disease, how much time do you have to prepare for the eventuality that will come? We think that those stricken with kidney disease, it crumbles very fast. And your hopes and aspirations disappear. But one element that we don't really appreciate is not only their personal hopes and aspirations, the family is also impacted. And usually, in any major illness, the family, the caregivers, are inevitably brought into that dire situation.
Yes.
And this is where we need to bring the family together, the healthcare providers, even society. But what I would ask is, don't pity them. Empathize with them, support them, be compassionate. Don't think they are the poor things. Because we make the mistake of just giving and without understanding that this person still has drive, still have a desire.
And still have the need to contribute.
They must have that need and they must have the desire to move on. We find that those who usually don't do well are those who have no reason to continue. It's a very difficult situation for them. They face 300 needles a year, multiple episodes in hospitals, a lot of downs, very difficult periods. What are the ups? Not much. You are tied to a machine. You can't even go on a holiday. And there is a lot of difficult times that we must walk with them.
Right.
Don't say we understand.
Right.
We don't understand.
So there are two approaches that you handle here. That is, first, the patient, giving them the adequate care as well as the dignity moving forward to help them in their recovery. And then the next thing is very interesting. This is the caregiver. Because like what you mentioned, there are often a group of people who are not in the in our vision, right, of who we should actually give our concern for, because we sometimes will only focus on the patient themselves. So can you tell us a little bit more about how NKF is actually helping the caregiver in this instance?
We involve the caregivers very early. So when a patient gets admitted to NKF, we require the caregivers or the family to be at the first admission application. Why? The caregivers must understand the journey, and the patient must understand the caregiver is walking alongside them. I'll tell you a scenario.
Okay.
We had a young, young is because they are about my age.
Relative.
And she was being admitted to NKF for the first time. And I was there to observe her admission. And they asked her, why are you coming to NKF? Her answer surprised us. I don't want to be here. They're like, if you don't want to be here, then why are you applying? Then they said, why? Why are you not interested to come into NKF?
Yep.
I don't want the pain. I've seen my husband go through it. It is very difficult. I don't think I have the courage to face the needles and to go on. And the daughter turned to her and said, Ma, don't give up. We are here to walk with you. Okay? And the mother's response was, because you all are here, I will go on. And that is important, that the caregiver and the patient comes together. Because there will be lonely times.
Definitely.
And you feel, and in the Asian context, a lot of our patients don't want to burden their families.
Yeah.
And they feel that they are a burden. So if they carry that on them, they will feel that it's better to go than to...
The will to live is very limited.
The will to wake up in the morning, the purpose. So I ask my patients, 15 years, 16 years, 20 years, what keeps you going? It can be as simple as, I want to see the sunrise. I want to see my grandchildren. I want to see my children get married. And there's a lady we know, and she says, I want to help other patients. Right. So you must find the intrinsic motivation to go on. The medical side, which is part of our mission, to give life and hope.
Yep.
If I can give you life, but you have no hope, you're just living and surviving. We find those with hope will do better with their life. But that's one thing I would like to say. They don't recover. They rehabilitate and be reintegrated back into the community. It's not something, unless you get a transplant, you don't recover.
What are some of the challenges that you face as a CEO when you step up in 2017?
The organization was a good organization.
Yeah.
The people were wonderful.
Yeah.
The patients were there, but I felt the culture from the patients was a challenge. They had this mentality of, I am sick, you have to look after me. Right? And my staff would kind of have their backs to the wall because you have patients telling you, look after me. I'm the needy one. And that is where the dynamics has to change. And this is where we work towards empowering the patients and empowering the staff to work together. It is not an entitlement. We try to stress to patients, this is your illness. You have to own it. If you don't, what are we here for? Right? And this is where we find the dynamics have changed now. For now, we introduce all patients are put on 6 months probation.
Wow, okay.
Why do we
hold them accountable for something?
Yes. And there are 3 things we look out for. Comply to your medical prescription and your treatment. Behave yourself. And pay us our fees. If you're unable to, let us know. We will work with you. Very simple, but challenging for some patients. And this is where we find a turnaround of ownership and responsibility.
Mm.
They then challenge us about standards, about quality of care, not from a perspective of give me, but let's work together.
Fantastic. I love that under your leadership, you are able to create very strong symbiotic relationships between caregivers as well as patient as well as the staff, to form kind of like a very strong foundation for this, I would say, ecosystem to work, because we are not separate. Our patients' recovery is not dependent on only themselves, but on the rest of the people in the ecosystem. But they also have to bear responsibility for their own health and recovery as well. So with all these processes, thoughts of systems in place, you are able to advance care in a more holistic manner. And I think that that's fantastic, right? Would this be the kind of motto that you have, that you wish for other people in the industry to have as well?
I would love to be able to close NKF down.
Yes,
Right?
because that which means that you have no need for NKF.
And how do I do that? It's not coming out with more services or transferring the services, but for people to take ownership of their health. The healthy, if you look after yourself, chances of you having renal failure is less. Awareness. That starts from there. And those who are not well, if you look after yourself, your journey will not be so painful. But that you can't save everyone. Should the time come where it's time to let go, do we let work with us with dignity? And the family comes to terms with the illness. It's a journey. So all social services should look at running themselves out of a job. Okay? Because we see a gap. We see an issue. Are we there to perpetuate this need? I think we do. I think we're in the wrong business. All right. We should be filling up the gaps. We should be advocating for change. We should be advocating for services that are needed for the interim period. We don't live in a perfect world, so not all problems will be solved. But we should minimize, we should highlight, and we should provide interventions.
Got it. And what would be the biggest misconception that people have about your job or even your industry?
We live on love and fresh air. Okay? Many times people think we have no standards. Our compensation is pathetic. We don't know what we are doing, and we're just giving. Okay? Sadly, some of people think it's a retirement job. You got nothing better to do, or you can't do anything outside. That's why you're in social services. It's furthest from the truth. That you do more with less.
And how would you encourage people who are interested to get into social service?
Is there an itch that you can't scratch? Is there something you feel that you want to change in society? Is there something that you feel waking in the morning just doesn't cut it?
And you have the power to change something.
Yes. As a lawyer, I wake up in the morning thinking of all the cases, other people's problems. So since coming to the sector, I'm motivated to try and do things to make things better for people who really need help. And I think that's a very strong intangibles in terms of compensation that the people in the social services have.
Got it.
Which they can't give in the for-profit.
And what has NKF taught you in the long service in since 2017?
Okay, this is my 5th anniversary. I do review whether I should continue in an organization every 5 years. I think I've come to the decision my job is not done. Now question, what's my job in the future? I think NKF is in a good place. Now we have to deliver. Okay, and deliver not what we see today, more services, more centers, but I think we have a model of care that Singapore can use, and even the region can learn on how do you care for people with renal failure. Give them the hope. Your services can be better. Where's the innovation? So we should push for innovation, better models of care. I think we have a firm footing to now take off. We were taxiing for a long time, trying to find a runway. I think we found a runway. Now we are taking full speed to have lift off.
Yeah. You spoke a lot about giving hope as well. What are some of the examples that NKF has given hope to your patients and, giving them that motivation to keep going despite knowing that they might never recover?
I think we try and better educate them on their illness, on their condition. That's one thing. Because we don't want to let them get caught. And I didn't know I'm going to go through this and the evolution of the illness. That's one, understanding. Two, let them know that this is your illness. Work with us, work with your family members. You are not alone. Because when you are alone, it's very lonely and it's very tiring. And if they give up, you may not know about it. So this is where we are working with nurses, psychologists, social workers, volunteers to work with them. Okay, COVID has not helped, all right? But as COVID has also helped in the sense that it brought awareness that you really need to get out of the house. You need to socialize. You need to meet other people. Our renal patients understand that, but the rest of community does not understand that until COVID came, right? We all die to go overseas, holiday. Our renal patients can't because of their modern treatment. So now we have a level playing field in terms of the understanding of isolation, depression. Okay, I lock you in 7 days in your house, you get so depressed. The patients go through that regularly. They're tied to a chair 4 hours, 3 days a week. That's all you get. And this is where I think we get empathy and greater alignment. So the patients now, we're on level playing field. We used to think that we are better than our patients. Now it's level. So that's, I think, a good awareness that our patients will feel they're not alone.
Fantastic. Yeah. And also with COVID, there is a greater appreciation for healthcare workers as well. Is there any words of encouragement for them?
They know how I feel about them, and I salute them. Not only my nurses, all across NKF. When the COVID came, I think our staff rose to the challenge. Okay, 80% of close to 80% are nurses. Another 10% are supporting the nurses. Another 10% are backroom. I'm glad to say that we did not drop the ball. We served over 2,000 COVID cases in a period of 2 years. Sadly, we lost 60 patients. Very painful. But the nurses never stopped. They never had an opportunity to work from home. My logistics, my cleaning staff, and all the social workers at the back, we came together. So I think it was a defining moment for NKF that we came together in a time of crisis, a national crisis. We took in patients from outside NKF when they had COVID, and we supported the healthcare organizations. I think when we asked for help, no one hesitated. No one asked me for OT. No one asked me for day off. And they just rose to the occasion and they stepped up. And I think that speaks well of my colleagues and speaks well of their understanding of what is entailing when we do our job. It's no longer a job.
I think the passion that your staff, whether it's frontline workers or everyone else supporting the organization, that they know that they can effect certain change in either the recovery of the patients or giving hope to the patients and the caregiver as well, right? That motivated them to keep going. What do you wish for people in the industry to stop or start doing?
I think that's a very difficult question because it all relates to our patients. What I would ask our colleagues or anybody in the industry is, don't look at today. Look at tomorrow. Can we do anything that can help the patients, the families, or even the way we deliver services? I think in many organizations, for-profit and not-for-profit, we are very comfortable doing what we do today. But the environment is changing. We are seeing more patients who are older. Renal failure is not the primary disease anymore. They come in with other complexities. We even see patients with dementia.
Wow.
We see patients with psychotic issues because we live longer and the stresses are all surfacing. And this is where renal is no longer just looking after your kidneys. We have to look after other parts of your body
and your
your
mind as well.
and the challenges that we find. The social issues are surfacing where a lot of our patients are alone. No family support. Because through time, work has become the primary motivation. And not all families survive crisis.
Yeah.
All right. And NKF serves close to 92% of all subsidized patients in Singapore. So we deal with the lower of the lower income. And that is an issue. But we are also going to help those in the lower middle income because we don't want them to fall into poverty because they're not able to work or they're not able to carry out some of their activities.
And it's important to actually have that awareness, even for people who may not have the disease, to empathize and not sympathize. There's a difference between empathy and sympathy, right?
Yes.
One provides dignity and the other one robs dignity away.
Correct.
Yeah.
Correct.
And I'm really happy where the heart of NKF is in the right place and providing that kind of support. If you were to write a book, what would it be about?
The one thing that I'm very concerned about is how do you lead an organization that has a social cause? Not all managers are good leaders, but all good leaders have to be good managers. And I think we have to understand what is leadership in the social service context or the not-for-profit context. Not all of us are equipped. I wasn't equipped when I came into this sector. I had a wrong understanding of what was leadership. My understanding of leadership then was to be the first one to stand up and get shot. All right, you take all the responsibility. You are supposed to know everything.
Take one for the team.
Yes. And I've learned leadership is not about you. It's not about the organization. It's about what you and your organization can do for the society. And this is, you need skills, and management is skills. So what's the difference between a good manager and a good leader? Right? And I think a lot of times we suffer from trying to be a good manager. But social impact doesn't stop at being a good manager. You know, we can be a good managers, but a very bad leader.
Yes.
And that would not allow the cause to be addressed. Because all you do is fighting with people.
Or getting things done. But actually in social service, there's also the heart aspect of things as well.
Yeah, but I would say the heart must not totally override the head because you need to balance and you will need to make difficult calls. What is your motivation? What is the guiding light in making the hard call? And this is where I think you mentioned about sympathy and empathy. We lean towards sympathy in the not-for-profit. And if for the for-profit to look at the not-for-profit, they seem to say, yes, I sympathize. You may have to make hard calls in the not-for-profit, but what is your motivation? What is the reason that you are saying no to a patient?
We spoke about leadership. Any advice for young people or young leaders who are in the social service sector for them to thrive in this sector and continue feeling motivated and I would say driven to continue helping the society?
Don't walk alone. Understand where your cause is. Don't think you will have an answer. A lot of us, because we are tuned to achievement goals, you may not be an answer. You may just be somebody that others will work on and develop something else. So it's not about I know everything.
Yeah.
I learned so much in the school, in the for-profit world. You guys in the not-for-profit, poor thing. I will come and save you. It doesn't work that way. All right. I think it's the other way around.
Yeah.
Okay. You are lost in the for-profit world.
Yeah.
You find your place in the not-for-profit world. So come in with an open mind. Humility is a big necessary element that is needed. And it's not a retirement job. Okay. They work very hard in not-for-profit.
So, guys, it's not a retirement job in the social sector. So think very carefully.
It's a new start.
Yeah. Think very carefully. So, wonderful. We've reached the end of the podcast, and really happy to have you. How can our audience support NKF?
Stay healthy.
Okay.
Look after your family members. All right. Enjoy your food. But whatever you do, in moderation.
Eat healthily, in moderation.
And stay active.
So that you don't have to come to NKF.
Never. You can come to support us. You can come
as a volunteer.
Work with us.
Yeah.
You can donate money to us.
Yeah.
That's fine.
So on top of taking care of yourself, you can, I guess, visit the NKF link over here if you would like to show your support. I guess I know that NKF is looking very actively for volunteers as well as donors. So continue showing your support in that manner. And thank you, Tim, so much for joining.
Eric.
Yeah, thank you.
Thank you.
If you have enjoyed our conversation with Tim and want to learn more about the social impact space, please leave a comment, like, and subscribe to our channel on all platforms that this podcast is on so that we can deliver new content to you. Epic Nation is a passion project created by the team at Epic Dialogue, a Singapore-based marketing agency that helps change-making businesses create social impact through our sustainability branding, communications, and digital marketing solutions.